This is Puneet Ahoja. I actually developed something called the aortic dissection. So very strangely, I'm told that it's very difficult to actually diagnose because it's asymptomatic. And I was fortunate enough that basically I did get diagnosed. I had a discomfort wherein I felt a choking in my throat because my office is right next doors to King's College Hospital. This was the first choice to come to the ER. The doctors at the ER were fantastic. They basically did the right tests. Obviously, I had to get a emergency surgery done, which was handled by Dr. Babar.
My name is Dr. Babar Bashir Chaudhri. I'm a cardiac surgeon here at King's College Hospital. Our patient Puneet had a life-threatening condition called a type A aortic dissection. This is a relatively rare condition and is difficult to diagnose, but has very severe life-threatening consequences. In this condition, what happens is that a small tear develops in the innermost lining of the aorta, and this can shear off, creating a false lumen in which blood enters. This has the effect of weakening the aorta, making it prone to rupture. The tear can extend to such an extent that it can involve the whole aorta. And in doing so, what can happen is that the major blood vessels that supply all the organs of the body, and we mean the brain, the organs of the abdomen, the legs, the spinal cord, can become damaged as a result of an impairment of flow into the arteries that supply them from the aorta.
The chances for an aortic dissection to come through are pretty minimal. I was told that I probably had about 65% chance of survival, and in fact 0% chance if I didn't go for the surgery within the next 48 hours.
This is a dangerous, life-threatening condition, and at the point of diagnosis, the risk of death is almost 2% per hour after diagnosis. So the majority of patients with this condition are expected to die within 72 hours. It's important that patients with this condition come to a hospital quickly, that they're rapidly diagnosed, and that they get the care that they need. Thankfully, in this case, this patient was diagnosed very rapidly, and he was taken very quickly to the operating theatre, and we did the surgery that was required.
So it was pretty intense at that point in time, but I think all the doctors around me basically gave me the right kind of guidance, although being honest about what the situation was, but they, I think, handled the situation extremely well.
So when we counsel our patients with this condition, we have to explain to them regrettably that the risk of death within 72 hours is very high. And really the only prospect for survival is surgery, and that surgery carries risks. Around 30% is the risk of a major complication associated with this surgery.
When you hear the first time that you have zero chances of survival if you don't get operated within 48 hours, it's not easy to basically digest that kind of a situation. And post that, knowing that the surgery is a very tricky surgery where there are chances that you wouldn't probably make it, makes it even harder. And now that I've made it, obviously it's kind of a second life. The whole thought process changes. When you've seen death that close, it's completely a mind shift.
So we took the patient to the operating theatre after obtaining appropriate consent from the patient and his family, and we performed an operation through the centre of the chest, where we replaced the majority of his aorta inside the chest with a synthetic graft. To do this, we used a special machine called a heart-lung machine, and we used a specialised technique where we perfused the brain and the heart independently, while effectively draining the rest of the body of blood, having cooled the patient to 22 degrees centigrade. This is difficult, complex surgery which requires training and which requires excellent teamwork.
Honestly speaking, I don't think I could have got better post-op care at the hospital. Dr. Nagesh, Dr. Rahim at post-care were fantastic. And here I am, 3 months down the road, probably 100% normal.
I'm very pleased and honoured to say that Puneet had a very smooth and successful recovery after his surgery. He was managed as expected in the intensive care unit. For a period of around 72 hours or so, he remained on the ventilator and sedated, just so that he was stabilised after his surgery. Thereafter, myself, my cardiologists, anesthetists, and other healthcare professionals, in particular physiotherapists, engaged with Puneet to encourage him to mobilise, to deep breathe and to cough. In general terms, patients who do best after cardiac surgery are the ones that understand that they're required to be motivated and engaged after their surgery. Puneet was such a patient, and accordingly we were able to rehabilitate him and discharge him from hospital at around the 2-week mark. And he was able to continue his rehabilitation through follow-up, adjustments of his medications, and through active physiotherapy, and through his own motivation by mobilizing, deep breathing, exercising and performing aerobic exercise. And he is now fully recovered and rehabilitated at 3 months. This is the usual pathway that we would expect motivated patients to recover after this type of extensive cardiac surgery at King's College Hospital.
If you are basically faced with a situation like this, where it's life and death and you need to get that surgery done, I think the best thing is to go in with a positive attitude, go in with a situation where you have to have faith, you need to believe in the doctors who are operating on you. Obviously, it's been a surreal experience, so life has taken a complete change, but yeah, back to normal, and thanks to King's College Hospital that I'm back on my feet and doing well.